Hi friends, this is Dr. Sitesh Roy, your allergist, immunologist and asthma specialist, coming to you with this special video on urticaria. Friends, I get a lot of calls and messages and visits to my clinic of people suffering from recurrent itchy rashes that come up on their bodies, sometimes with and without swelling. So today we shall talk about what chronic or acute urticaria is and how it is managed. Urticaria, hives, welts, itchy rashes, there are many names for this, but this condition, when it occurs to someone, can be very disturbing and very problematic. When urticaria or hives occur for less than 6 weeks, we call it acute urticaria, and when it occurs for more than 6 weeks, we call it chronic urticaria. In acute urticaria, the commonest causes are after a viral infection or some kind of an infection. There can also be medications involved that trigger the urticaria. There can be insect bites involved that trigger the urticaria. There can be food allergic reactions that can trigger the urticaria. And in such situations, when you see an allergist immunologist, they will help you through a very carefully delineated history to identify what the potential sources or triggers are and help you eliminate them, and then use the right kind of anti-allergic medications and in some cases even steroids to bring the problem under control and then make you symptom free and medication free. When we talk about chronic urticaria, it tends to be a different issue because this can go on for weeks, months and sometimes years. I have seen a patient who had 32 years of hives and itching every single day of his life, and sometimes even despite taking medications he would get the problem, and he had seen multiple specialists and not gotten relief till we did a series of investigations for him and helped him identify his causes, which were actually more than one. In chronic urticaria, in a rare case, you may have an allergen that is triggering the reactions. We say in less than 5% cases, but it is still important to rule these out through allergy testing in whatever form is appropriate, skin or blood. We also then recognize that autoimmunity, where someone's own immune system reacts against their body, is a very big trigger of chronic urticaria. Follow that up with different types of low grade, sometimes barely symptomatic chronic infections that can be there in the body that can lead to chronic urticaria. And then a very big trigger is stress. Stress is not only mental stress where someone is worried or tense and worrying all the time, but it can also be physical stressors, biochemical stressors. There are many different types of stressors that a human being can face. So when a case like this comes to our clinic, we do a very careful history, a very careful examination, try to eliminate the myriad of causes that are there in chronic urticaria. I have only mentioned 4 or 5 of them. The list goes much longer than that in terms of diseases that can trigger chronic urticaria. And there is also something called idiopathic urticaria, where even despite investigations, we cannot find a single cause. And even in these cases, there are very specific therapies that can work for these individuals very well and very successfully. Once we have found the triggers and we have worked on eliminating the triggers, we then work on medications which are generally non-drowsy, non-sedating, anti-allergic medications, with or without combination of other medications that can work to make the person's immune system calmer, less reactive, and hence less likely to cause itching, redness, swelling on different parts of the body. Once we have put the patient on therapy, we have to see them for follow-up so that we can adjust the medications, and when they have gone several months without any symptoms, we try to taper off the medications. In a small number of cases, we have to use even immunosuppressing drugs and even something called biologic therapy which can go a very long way in settling down a person's chronic urticaria. So friends, I hope you have a better understanding of what acute and chronic urticaria are through this video, how we evaluate them. There are certainly blood tests that have to be done along with the remainder of the investigations that I mentioned, but with it we can very often find causes and help an individual come out of the problem over a span of time. So till the next video, friends, take care, stay safe, God bless us all.